The Aurora dedicated breast MRI is designed to be the complete solution for breast MRI diagnosis. One major component of this system is the system for image analysis called AuroraCAD. Breast MRI systems are capable of generating large numbers of images that can be further processed into even larger numbers of images. However, making lots of images for the radiologist to interpret is not the objective. The goal is to provide information that can assist the radiologist in efficiently rendering accurate interpretations. The AuroraCAD tool is designed to achieve this goal by being able to rapidly analyze the image data, to visualize problem areas, and then to display the most important information to help accurately determine the diagnosis. The image data can be viewed quickly. Enhancing lesions can be found and then displayed in ways which diagnostic details are efficiently exposed. AuroraCAD provides a complete platform for breast MRI viewing and image processing. It is built around dual processor, dual core Xeon chips, providing the equivalent of 4 parallel processors. AuroraCAD integrates the revolutionary imaging capability of the Aurora scanner with the spiral rodeo into a package that is capable of providing the following features: simultaneous viewing of multiple sequences on the same screen, real-time orthogonal and oblique image reformations, maximum intensity projection ray tracings, subtractions with three-dimensional registration for correction of patient motion, color coding, washout, plateau, and persistent dynamic curves, fluid and edema, and a number of automated measurements including regions of interest, ROI, linear distance, volume, and surface area. Probably the best way to show the use of AuroraCAD is to actually examine a case. Here's a patient who had a palpable mass. Her CC and MLO mammograms did not show any change from the year before. Magnification views show a subtle density, but no calcifications were visualized. The ultrasound examinations demonstrated abnormal hypoechoic regions at the site of the palpable mass. MRI was done to evaluate for the extent of disease. You can lay out the AuroraCAD screen according to your own viewing preferences. In this layout, we have the pre-contrast image in the upper left, the immediate post-contrast image in the upper center, and the delayed post-contrast image in the upper right. On the lower level, we have on the left the maximum intensity projection, MIP, of the immediate post-contrast images. In the lower center is the subtraction of the immediate post-contrast series from the pre-contrast series. In the lower right is the MIP of the subtracted immediate post-contrast from the pre-contrast. The way I usually start viewing a case is by looking at the MIP of the immediate post-contrast rodeo. These images have the best anatomy and signal-to-noise ratio. In this example, you can see a large mass with some smaller satellite lesions. One lesion inferiorly may be a clinical problem, since it is far separated from the index mass. By reviewing the MIP images, you can hone in on the problem areas and spend most of the rest of the review time concentrating on getting more specific information on those areas. I next look at the subtraction MIP images. The signal-to-noise ratio of these images are not as good as the MIP of the immediate post-contrast acquisition, but here the contrast enhancement is pure. If we have a bright lesion on the immediate post-contrast MIP, it could be other bright lesions like proteinaceous cysts. On the subtraction MIP, these cysts will disappear. So we find several areas of suspicion in the right breast. We now look at the individual slices. When we compare the immediate and delayed post-contrast images, we see these lesions enhance very brightly on the immediate post-contrast images and appear to wash out on the delayed images on the right. We see a clip artifact. It's a black spot in the mass. The mass is spiculated. This would be typical of an infiltrating carcinoma. There are multiple satellite lesions. Inferior to the index mass in the lower right breast is an incidental enhancing lesion. This area needs further examination. We apply multiplanar reformation tools, MPR. A large spiculated mass is seen. Notice that the sagittal and coronal images are equal in quality to the axial images. This is because spiral rodeo has almost equivalent voxel resolution in all dimensions. The MPR tool shows the inferior region of non-mass-like enhancement running in a ductal pattern, primarily in the anterior-posterior direction. This may be another focus of disease. Now we go back to our 6-on-1 format and click the flip button to reveal another pre-programmed diagnostic screen underneath. The lower center frame remains the immediate subtraction, but the lower right is changed to the delayed subtraction. These images give the visual effect of the washout. We now turn on the color map. Washout shows up as red on the images. We move through the questionable inferior enhancement and find that this lesion has washout as well as the index mass. We can do a region of interest, ROI, of the areas and display the curves. The curves demonstrate washout, and the curve is a red color. We can enlarge the ROI to get better statistics. We move to our incidental enhancing lesion inferiorly and show washout in that lesion as well. We will talk more about AuroraCAD color encoding features later in the presentation. It is often helpful to view lesions in oblique planes. Aurora provides a handy viewing tool for this purpose. You click the sequence that you wish to reformat. Then place the ROI in the center of the lesion. You can see the washout enhancement with a red curve. Then select the OBL button for oblique viewing. On the left-hand side is the MIP of the series of images. This provides a global view of the abnormality. On the right is the slice calculated at an angle through the center of the ROI. The angles are interactively manipulated to display the anatomy of the lesion. This lesion appears to have irregular and in some areas spiculated margins. Let's go back and look at the incidental enhancing lesion in the inferior breast. We select the ROI for rotation. See the enhancement curve. Then we implement the oblique button. We see the MIP on the left and the oblique slice on the right. We manipulate the images so that we line up with the natural plane of the lesion. The breast is not organized in orthogonal planes, sagittal, axial, and coronal. Fortunately, with spiral rodeo, you do not need to pick your viewing plane when you scan. A high-resolution image can be calculated interactively on AuroraCAD to match the best plane for the lesion. This double oblique slice shows the branching clumped enhancement pattern typical of DCIS. This patient will have chemotherapy, so we need to know the original size of the tumor. This calculation would be difficult by linear measurements alone, but AuroraCAD has the ability to measure the lesion volume and surface area on a voxel by voxel basis. We start by going to the MPR tool and locating the axial slice with the greatest tumor area. We draw an ROI over the enhancing mass and make sure that it is large enough to cover all the region of enhancement in the mass. Initially, we see an enhancement curve. We select the flip switch. Then a three-dimensional volume of the tumor is displayed. We adjust the threshold by changing the location of the center voxel and intensity. The tumor volume and surface areas are displayed in the lower right corner of this frame. We now look at this patient after chemotherapy. We can see from the images that she's had a dendritic response to chemotherapy. Several scattered islands of tumor remain. In this situation, it is very difficult to estimate the tumor volume by linear measurements. We apply our ROI as before and display the tumor volume in the lower right corner. We can rotate our volume to check the size. The tumor volume and surface area numbers are seen in the lower right of the frame. Clearly, this is a partial response. The most commonly used image displays are pre-programmed from the factory, but the image display can be customized to your individual needs. You can pick which series that you want for each frame. You can select which image projection, sagittal, axial, or coronal. You can select the number of frames per screen. Design a custom format, for example, Dr. Smith. You can select a protocol for each frame, including the acquisition, various types of subtractions, different MIP images, or various enhancement curves. Aurora has a number of display protocols available depending upon the clinical situation. On this series, you can see the cancer displayed sequentially from the pre-contrast in the upper left, next is the immediate post-contrast, and moving forward to the last post-contrast image in the lower center. The enhancement curve is in the lower right. You can visually see the lesion enhancing and washing out. This can be displayed for a single point on the curve. We flip the screen to see the subtraction images that are sequentially displayed, looking for enhancement and washout. Here's another patient with a large mass in her right breast near the chest wall. We look at the initial post-contrast MIP and the subtracted MIP images. We do an MPR to show the mass in the sagittal, axial, and coronal planes. The mass has spiculated margins. Now we go back to the 6-on-1 images. The mass gets brighter on the delayed images. If we flip the screen and look at the delayed subtraction, we get an even better idea that this lesion has persistent enhancement. Now we turn on the color map. Red indicates washout, yellow indicates persistent enhancement. The mass is predominantly persistent enhancement. We generate curves which show persistent enhancement. Notice that the curve changes colors as we go from washout to persistent enhancement. This lesion was a focal area of fibrosis and not cancer. In another patient, we see multiple enhancing and non-enhancing masses. There's a dominant mass in the axillary tail of the left breast. Other smaller enhancing masses are seen medially along the chest wall. Another mass in the subarachnoid region is bright on the pre-contrast images and turns darker on the post-contrast images. This is typical of a cyst. The pre-contrast rodeo images are non-spoiled, and long T2 fluids are bright. The post-contrast images are spoiled, rendering the long T2 fluids dark. Unlike most other subtraction displays, AuroraCAD subtractions are able to use both positive and negative scales. Therefore, the AuroraCAD system can distinguish cysts from enhancing lesions on the subtracted images. This type of image processing is not possible using T2 images, and the resolution of the non-spoiled rodeo is far superior. In addition, Some cancers are bright on T2 weighted images and are difficult to differentiate from cysts. The high intensity of cysts on non-spoiled images is specific for long T2 fluids, and cancers will not be hyperintense. Color mapping is helpful in this case. We see predominantly red-colored washout enhancement in the index mass and in the masses along the chest wall. These turned out to be multiple cancers. We see the subareolar mass as blue. We do an ROI and see the curve go down below 0, typical of a cyst. To show how color coding of cysts and edema is helpful, we show another case of multiple cysts. These lesions are hyperintense on the pre-contrast, non-spoiled rodeo images. These lesions turn black on the subtraction images. We turn on color coding and we see the blue cysts. Green is used to encode edema. Both breasts are green, indicating diffuse edema. This patient has fibrocystic change. The fluid and edema encoding is a unique feature of AuroraCAD. Color mapping has factory-selected default selections, but these parameters can also be adjusted interactively. The threshold and noise levels can be changed to improve the image appearance. The washout peak enhancement and the plateau can be adjusted. The type of CAD encoding can be selected either through the menu bar or the button on the side of the image viewer. Color coding is now available for washout, red, plateau, magenta, or persistent yellow enhancement. Fluid encoding is available for pure fluid, blue, and edema, green. You can select any one, a combination, or all to display. A number of other encoding features are planned for the future. With spiral rodeo, there's a wealth of information yet to be uncovered. We evaluate another patient with AuroraCAD. First, we look at the MIP of the immediate post-contrast series. She does not have any abnormal enhancement in the right breast. If we look at the left breast, we see a subtle area of enhancement. This lesion is also seen on the subtraction MIP, indicating that it is indeed enhancing. Looking through the slices, we note that the lesion appears to be well marginated. Moving to the multiplanar reformations, we see that the mass has good margins and is ovoid in configuration. Moving back to the 6-on-1, we flip to the subtracted images below and see that the lesion has persistent enhancement. We do a color map, and indeed no washout is present. We calculate a curve and show persistent enhancement. This lesion is typical of a benign appearance on MRI. In this example, we have a patient with silicone implants. We change our screen format to the pre-programmed silicone protocol. The first screen is essentially the same as what we have shown for our routine cancer display. This is a screen that we use for evaluation of enhancing masses. We click the flip screen, and now we see the silicone-specific images. The image in the upper left, a T1 weighted gradient echo, is done for the evaluation of the inner parts of the implant. This specifically looks for intracapsular rupture. If present, the linguini effect can be clearly seen within the implant. The middle image is unique to Aurora. This is a silicone-specific rodeo. Here, instead of suppressing fat, the rodeo suppression is moved to the silicone portion of the spectrum. Silicone turns dark, and small collections of free silicone in the breast parenchyma can be identified. This sequence has the same high resolution as all the other rodeo sequences and matches image for image with the post-contrast series in the top right frame. Sometimes silicone granulomas can enhance and wash out, and it is important to distinguish these lesions from neoplasm by the small silicone inclusions intermixed with the fibrotic tissue. Patient motion can be a problem in breast MRI. As breast MRI systems strive for higher resolution images with smaller voxels, motion may become an even bigger issue. When motion-affected images are subtracted, artifacts are produced, and important lesions may be missed. However, AuroraCAD has a solution. The Aurora system has a special registration program that evaluates the image in all three planes and accounts for the non-uniform deformities that can occur in breast shape with movement. This registration program is where the heavy computer horsepower of 4 parallel processing chips comes in handy. In this patient, we have an etched look to the subtracted images. This is due to misregistration of the subtraction. We press the registration button and all the images are registered and the frames updated. The enhancement curve points are also corrected with the registration process. Linear measurements are easily obtained. We measure this mass in all three planes. We measure from the mass to the nipple, the chest wall, and the skin. We can put sagittal and coronal images in our 6-on-1 frame. We click on an ROI and it shows up in all three planes. We can save individual frames, the entire layout, or generate a movie. We click on the movie button and a movie is automatically generated. This is helpful for referring physicians. The images can be annotated and arrows applied. We are not limited to a 6-on-1. You can select a single frame and display it as a 1-on-1 or any number of other arrangements. AuroraCAD is built from the ground up for breast MRI diagnosis. The system is fully integrated with the revolutionary capabilities of the Aurora scanner. The system is designed to fully exploit the efficiency and depth of information available from the Spiral Rodeo acquisitions. These features combine to build a platform for even greater enhancements in the future.